effectively. And that workforce challenge is further augmented by the fact that even though they may be experts in the laboratory and great scientists, it leads to an uncertain career path. The career progression is not complemented by requirements for some leadership or management training. And as a result, a person might become a laboratory director, but may not have the access towards the resources that will help in better planning and better financial arguments to support the lab for what it needs. Now, this need was realized by the leading partners around the world who have supported laboratory systems in countries through technical support and in-person support, namely that you will see all the partners in the next slide who worked on the idea and the concept of coming up with a program called as the Global Laboratory Leadership Program. Next slide, please. So what is GLLP? In essence, it started as a collaboration of the 6 partners, namely Food and Agriculture Organization, the World Health Organization, the World Organization for Animal Health, the European Centers for Disease Control, the US Centers for Disease Control, and the Association of Public Health Laboratories. And the central idea for the collaboration was to work as a joint partnership, to bring all the resources together and the great minds together to develop a competency-based laboratory leadership program, which focused on building sustainable laboratory systems using a One Health approach. So while capacitating leaders in the health sector is important, the partners realized from the beginning that this needs to be a comprehensive approach covering animal, human, and environmental health at the same time. Next slide, please. So the vision of the Global Lab Leadership Program, or the GLLP partners, was help countries develop laboratory leaders who are empowered to thereby strengthen the national lab systems across the globe and using a One Health approach, thereby strengthening health security. The mission of the partners is to provide the lab professionals with the tools so that they can develop their lab leadership competencies and thereby advance their effective national laboratory systems towards improved health security. And it seems like I'm repeating the same words again, but the vision is long-term, and the mission actually provides the pieces towards achieving that vision going forward. Next slide, please. So we understand the goal. The goal is foster and mentor current and emerging lab leaders to build, strengthen, and sustain national laboratory systems. But the program is ingrained with 3 key values. It is entrenched in One Health, so all the different sectors go through the process together. Highly recommended. It has to be owned and led by the countries, so it's a national ownership or a country ownership which should lead it, because the health systems that need to be strengthened are at the national level. And it needs to be sustainable. It needs to be an ongoing process so that the laboratory leaders are always available and the lab systems stay strong. Next slide, please. So who is the target audience? And remember, this is a global program. And yes, we understand that we require a One Health approach. But who are the people that we would be targeting in this program? So the audience is diverse, as can be understood. It can be clinical, diagnostic, medical, public health, animal, environmental, or any other labs that can perform the testing for the purpose of diagnosis, for the purpose of disease screening or prevention, for things that lead to medical treatment decisions, which might have an implication for public health, or which support surveillance initiatives. So the idea and the vision is to have multidisciplinary and multi-sectoral cohorts for a One Health approach, because that not only helps strengthen the laboratory system for one sector, it helps strengthen that coordination and collaboration at the national level across labs. Next slide, please. So as a first step, the 6 partners of the GLLP developed a lab leadership competency framework. So they deliberated and highlighted and recommended 9 key competencies that need to be acquired by laboratory leaders across the 3 One Health sectors so that they can better lead their laboratories and can strengthen the lab system. This is the first document that was published by the partners, called as the Laboratory Leadership Competency Framework, which is now being shared in the chat for all of you. And that outlines the details of these 9 competencies that you see on the left side of the screen. These competencies have particular breakdown of modules and content that I will go to in the following slides, but in no particular order are leadership, management, communication, quality management system, biosafety and biosecurity, disease surveillance and outbreak investigation, emergency preparedness, response and recovery, research, and all of these culminating together in a laboratory system. And when these 9 competencies are covered in the prescribed program format, along with other components of the Global Lab Leadership Program, it provides a comprehensive menu of skills and tools that the lab leaders can apply. Next slide, please. So here are the 4 contents listed in a graphic form for you. There's a learning content linked to those 9 competencies that I mentioned a minute ago, which is called as the didactic component or the learning content. So it's the knowledge that they need to understand as lab leaders on the 9 different areas and how to apply it. They get to be mentored. All participants who go through the program get to be mentored through the process. They are supported by experts and people who have more experience in the field throughout the process of the program. In order to apply what they learn in the didactic piece, small projects are completed by the participants during the course. And by completing these small projects, they are able to understand better by doing what they learn in the class. However, each of the participants also works on a capstone project, which addresses, ideally, an identified national need in the lab system. So thereby, while they're going through the program, they are not only learning, they're also contributing towards making their lab system stronger and have a vision towards working to strengthen it further as they get out of the program. Throughout this process, we have these multi-sectoral cohorts. We have participants who are representing the 3 different One Health sectors, and we have a community of these lab leaders that is developing at the national level, who are interacting with more experienced individuals who facilitate their learning, but also mentors who facilitate and help them develop their projects and implement their projects. Now, this program is not a one-off training. It's not something that a country can do once and think that that's going to be helpful for the next 10 years. It's an ongoing process. That's why it's not a project, it's a program, and it's a commitment that is owned and led by the country. Next, please. So I'm going to come back to the learning package, and that's a snapshot from the website where the materials and tools for Global Lab Leadership Program guidance are hosted currently. The learning package is a comprehensive package which provides the information and the resources, starting from planning of the program, developing the content and the plan of implementation on how the program will be delivered at the country level, and then evaluating the leadership program either at the regional level, at the country level, or an educational institutional level in the world. Now, if you look on the right side, right now the way it's structured is there's a welcome kit, which will give you all the bare bones of what the program is about, some of the FAQs and brochure about it, the competency framework document, and what are the specific modules in there. But then there's an implementation toolbox which focuses on the different phases of program implementation, such as what needs to be done before you even start planning, whether the country is ready to move ahead with the program, what are the different actions that need to be taken before even the planning process can begin. And then a planning and implementation guide, how to select participants, training of trainers, and tools for guidance on mentorship, the tools for guidance on projects and monitoring and evaluation, et cetera, et cetera. And then there is a piece of the learning package, which is currently unrestricted access, it's course materials. And that is the didactic materials, which are delivered to the participants that are selected to participate in the program, along with a reference list, et cetera, et cetera. My colleague, Jocelyn, will be talking more about the didactic component in the panel discussion subsequently. Next slide, please. So in a brief overview, the didactic component has 43 modules that are divided between those 9 competencies. And the materials that cover these 43 modules include PowerPoint presentations. There are guides for instructors and participants on how to go through these modules and how to learn. And there are supplementary documents that help in facilitating that learning along with pre-work as well. I think I talked about the implementation guide and the implementation toolbox, et cetera, and other guidances, so I wouldn't cover it. On the right-hand side, you see a snapshot of the health security learning platform, which currently hosts the package. And in terms of the didactic component, there are multiple options that can be considered depending on what resources are available and what the country wants to plan. There's in-person or face-to-face delivery of these modules, which of course is the best option to go through. However, virtual instructor-led modules, all of these modules are also available in the virtual instructor-led mode. And there are some modules that are under development using the e-learning modality. Can you click once, please? We just want to highlight that all materials are provided in editable formats so that they can be adapted. They can be customized to the regional or the country-specific context. So remember, this is a global lab leadership program. There's a lot of flexibility in the materials for each country team or a regional team to look at what are the current conditions there and what would be more applicable to impart as learning materials to those participants to facilitate their learning. Next slide, please. We often get questions about where people are not able to differentiate more clearly between the Global Lab Leadership Program, the Field Epidemiology Training Program, which in some countries also has a laboratory component, and also the SLEMTA program, which is related to lab quality at the lab facility level. And here's a quick distinction and differentiation of the different programs. I think the field epidemiology program would be the first one and is the one that is very commonly compared and contrasted with GLLP. Well, first off, the field epidemiology program essentially targets field epidemiologists. Even though it may include some laboratorians, a lot of those laboratorians then become epidemiologists or field epidemiologists because the focus of the program is to strengthen the capacity for epidemiology, for surveillance, for outbreak investigation and response. On the other hand, the Global Lab Leadership Program is targeting lab leadership and management competencies and is targeting mid to upper career level lab professionals who have at least 2 years managerial experience managing their own labs. There are certain contrasts in the delivery of the programs. The field epidemiology has different versions, frontline, intermediate, and advanced programs. For the GLLP, the recommendation is that all 9 competencies and all 4 components of the programs should be completed for it to be considered a full GLLP program. And the duration can be variable. We have different instances around the world where countries have completed it from 18 to 24 months, or even less. The third one is the SLEMTA program, which is facility-level technical lab management, and that leads to facilitating a lab, strengthening a lab towards accreditation. So this focuses on one lab only and working with people in one lab only, while the Global Lab Leadership Program, when run at a country level, can help strengthen the entire laboratory system across sectors. Next slide, please. So let's look at some numbers that we have from around the world. Now, I think I missed it when I talked about the introduction. Really, the global GLLP competency framework was published in 2018, 2019, and the program really took off towards that time. And from then, in a journey of 6 to 7 years, we have the program, which is being implemented by over 32 countries. These 32 countries have implemented the GLLP either as one cycle, have already completed one cohort, or are going through one. Some of them are already on their third cohort. And the countries that you see underlined here are ones that have also gone together through a regional program. They have worked together in a regional program, participated, and now are going forwards towards planning for their national program implementation. We have a few additional countries listed here that are currently in their planning and pre-planning stages and will be subsequently kicking off their programs. So what are the achievements? We have 418 participants and counting, over 230 mentors, which are across the sectors, that have gone through the program and are continuing to do so. Understandably, a large number of these graduates and alumni are from the health sector, but there is a growing number of participants who come from the veterinary sector, as well as increasing representation from colleagues who work in environmental sector laboratories, including food safety labs. And so you can understand that what we are getting is a global community of practice, which essentially still is focused at the country level, where the different sectors learn to work together and are familiar with what to do and who to reach out to when there is an emergency. And I think the next slide is my last slide. In case you're curious, where in the world is the program? Then you can look at this map where it seems we're going across the 6 regions of the world, and many countries are going forward and looking green, continuing with country programs or sub-regional programs. I hope I've not taken up too much time. I see Lidovai has opened up her camera, so I will hand over to you, Lidovai, for the panel discussion. Thank you very much.
Thank you, Uzma. So it is my honor to moderate this panel with 3 wonderful panelists. We have Jocelyn from APHL, we have Virginie from WHO, and we have Jennifer from WOA. We're going to ask 4 questions, and they will have 5 minutes each. I'll try to keep them on time very gently. And then at the end, we'll have 5 minutes for Q&A. So to kick this off, I'd like to first direct my question to Jocelyn. So Jocelyn, can you describe the GLLP didactic component and the benefits of this program model, please?
Thank you, Lidovai, and hello, everyone. It's really a pleasure to be here today to discuss GLLP, so thank you for joining. So the question is to describe the didactic portion of the program and describe the benefits of the program model. And I'd like to start by just saying that the didactic portion of the program really serves as a foundation for the program, but it doesn't stand alone. Dr. Uzma had described the 4 program components: the didactic learning, the mentorship, the project-based learning, and the community building. And these 4 components really work together to create the full GLLP learning experience. But let's really talk about the didactic learning component, and we'll start with the basics. So Dr. Uzma described the didactic component briefly. The curriculum itself is really quite extensive, and it includes over 200 hours of structured learning captured in those 43 modules. The curriculum is competency-based, so the content of the modules supports the development of all the competencies in the laboratory leadership competency framework that Dr. Uzma had provided information on. If you compare the framework with the curriculum, they do not appear to follow each other exactly. They don't follow the same structure. But I guarantee you all the competency domains in the framework are covered in the course curriculum. We just realized as we were developing the curriculum that the flow of the competency framework didn't necessarily lend itself to the educational design of the course materials. But rest assured, all of the competencies in the framework are addressed in the curriculum. So the development of the course content was supported by more than 160 international experts from across the human, animal, and environmental health sectors. So the curriculum really has a strong One Health grounding, and it is a globally informed, scientifically rigorous, and the content is really relevant to real world challenges. All of the course materials were developed using adult learning principles. So rather than relying on passive lecture style teaching, the sessions incorporate case studies. We have group work, we have facilitated discussions and scenario-based exercises. And this really makes the learning more engaging and meaningful. And it really helps to facilitate that peer-to-peer learning that's so important in this program. So the participants, as Dr. Usma mentioned, are from multiple sectors, and these participants from multiple sectors are often engaging really for the first time. So the peer-to-peer learning through the discussion and through the exercises, it really can be quite powerful, and not only for the participants, but also for the instructors too. Oftentimes, this is really the first interaction between the sectors. So to support the countries in implementation, the GLLP provides the learning package that Dr. Usma presented. And as she mentioned, it includes slide decks. It includes detailed instructor guides with detailed speaker and facilitation notes. It includes participant guides, and there's also supporting resources available. And as she mentioned, these materials are available for in-person and virtual delivery. Several modules are also currently available as self-paced e-learning courses. And although these e-learning courses are not meant to replace in-person or virtual sessions, they really can be used in conjunction with the standard materials. For example, e-learning courses could be assigned as pre-work, and that would allow a bit more time during the in-person sessions to focus on perhaps an overall review of the materials, but then really honing in on question and answer sessions and more time for activities and discussion. The learning package also includes materials for a training of trainers program, and this TOT really helps the instructors learn to adapt and deliver the curriculum effectively. And this will help support country ownership and maintain program quality. So from my perspective, two of the major strengths of the didactic component are its flexibility. And this flexibility really supports country ownership and also its One Health approach. So the program was designed to be flexible in its implementation model as well as in the program design. So the program was designed to be delivered in 18 to 24 months, and that includes a 6-month capstone project period. However, the countries can design the program that suits their needs and as well as their resources. Some countries have implemented over a 12-month period, and some choose the full 24 months, or somewhere in between. Some countries have only in-person sessions. Some choose a hybrid approach with some virtual sessions included. It really depends upon resources. It depends upon geography. It just really varies. Some countries have also chosen to engage participants in a series of 2-week didactic sessions. Some prefer 1-week sessions, but the schedule for the program is flexible, and it can vary according to country needs and the availability of as participants as well as instructors and mentors in the country. Although it's highly recommended that the full curriculum is presented, the countries can adapt and should adapt to the material according to their needs. So content can be modified. Some countries have chosen to remove some content, and although we don't recommend that, it may be appropriate in some settings. Some countries have also added content that they feel is necessary within their context, and that's absolutely fine as well. So the full curriculum is provided. All the materials are provided in order to present the didactic portion of the program, but the program is really designed to be flexible in order to meet those specific country needs. And then the second strength of the didactic component, I think, is the One Health focus. And this One Health focus is really woven throughout the course materials. The course materials include content that's relevant to all three sectors, human, animal, and environmental health. And it brings and the program brings participants from these sectors together. And this naturally strengthens multi-sectoral collaboration that may not otherwise occur. The curriculum content provides all sectors' perspectives, and the activities and the exercises are relevant to all the sectors. So this is not a human health program. This is a One Health program, and the environmental and the animal health sectors are represented. So the GLLP model is also committed to continuous improvement. We collect feedback from participants, from instructors, from implementing countries, and we regularly review it, and it's used to revise the curriculum. We are on the second version of the curriculum now, and we are constantly learning, and we, being the GLLP partners, are constantly learning from implementations and adapting to improve the program. And we really encourage countries to do the same thing. As they proceed through subsequent cohorts, we anticipate that the didactic materials will be adapted and improved in order to meet the needs of the country. So to summarize, the curriculum is comprehensive, it's competency-based, and it was designed using adult learning principles. The implementation model is flexible, and it encourages countries to tailor the content to their own priorities and their own laboratory systems. The curriculum has a One Health foundation, and the model encourages collaboration across human, animal, and environmental health sectors. And the didactic content engages learners to explore and understand all sectors' perspectives. And finally, the model encourages commitment to continuous quality improvement. And we want to ensure that the curriculum remains aligned to new challenges and new scientific advancements. So I believe all of these features make the GLLP didactic component a really powerful tool for building skilled and confident lab leaders. But it doesn't, as I mentioned to start, it doesn't stand alone. The strength of the program is in the didactic content combined with the mentorship, the project-based learning, and the community building. So I'm going to pass back to you, Lidovai, so we can discuss the other program components. Thanks.
Wonderful. That's a nice segue into the following questions, indeed, because this is a program that is not just a didactic component. It also has, for example, mentorship. So I want to hand over to Virginie, and I would like to ask Virginie if you can describe the mentorship component of the program and what do you think is most important for success of this program component. Over to you.
Thank you, Lidovai, and hello again, everyone. My name is Virginie Dolmazon, working for the WHO headquarters. Very happy to be in this panel today and to exchange on the GLLP components. As Jocelyn was saying, there is no one component more important than the other. The mentorship component is also working hand in hand with the other component of the program, so didactic, project, and the community of practice. Lidovai, to first answer your question, I think we need to first define what is a mentor. We have a definition of mentor. In my head, I see somebody very experienced, let's say, that I can reach out to. And it's also in the GLLP context, let's say what it is. This is a senior level laboratory professional who will support the participants in the program throughout the program, from A to Z. So throughout also all of the components of the program, from the didactic component to also the networking building piece and the project component. Here in this program, I think it's clear that we are focusing on the soft skills more of the laboratory professionals, of the leaders or the leaders to be. So how to best, let's say, acquire these soft skills or improve the soft skills is exchanging within the peers, and it happens with the other participants in the program, it happens with the instructors, and it also happens with the mentors, so with the experienced professionals. I think it helps very much to, again, exchange with the peers and exchange with the mentors to challenge them and to be challenged. So it's, in a word, what it is, mentorship in the GLLP. Practically, what happens is that each participant is paired with a mentor for, again, the entire duration of the program, from A to Z. And they exchange regularly throughout the program, through meetings, meetings, virtual, face-to-face. Of course, I mean, from experience, we encourage as much as possible in-person or face-to-face interaction. It helps, but it's also possible to set up some other kind of interaction, virtual, email, of course, whatever communication style. This is also something to be discussed and decided between the mentor and the mentee. I should say this is a relationship between two individuals, the mentor and the mentee. This is not the traditional mentorship or twinning, maybe more technical, that we can think of at the lab level, and that works also very, very nicely. But here, this is really to build the relationship between the mentor and the mentee, so more at an individual perspective. And the role of the mentor during the support for the mentee is to help developing the leadership skills of the mentee, also reinforcing even the didactic learning, if needed, of the mentee. That's also why we are encouraging the mentor to be present as much as possible during all parts of the program, including the didactic parts, to understand what the mentee is going through. So that, again, helping the mentee during the didactic learning. A second very important role is also supporting during the project, the small projects and the capstone projects development and implementation, exchanging on like the how to best select a capstone project topic. And we really would like the capstone project topics to link to some national priorities. So here, having an experienced professional being able to advise, to read maybe better the national priorities and strategies could help very much. And of course, in the implementation of the projects. Also, throughout the program, the mentor can help, let's say, the mentee growing in his professional journey, growing in his career, thinking about the next step and the step after the next step, and also helping building the professional network of the mentee with the other participants in the room, with the instructors, with the mentors, and much beyond. There are different modalities, let's say, for how to build the mentorship component. We advise not to have more than 2 mentees per mentor. We know that it's not easy to find 1 mentor per 1 mentee, but if possible, not to go beyond 2 per mentor. 2 mentees per mentor, because this is really a time-consuming also job for the mentors. It is also possible to consider having mentor from a sector that is different from the mentee sector. It can give a different perspective. It can really, let's say, elevate as well both the mentor and the mentee. All of that is to be considered in the program, the country, and the regional context, of course. Everything is open. And to answer to the second part of your question, Lindeva, that was more on how would that best work. I think from the start, the mentors need to be engaged and, let's say, selected, and understand the commitment that comes with their engagement in the GLLP as mentor. There are, let's say, roles and responsibility for the mentors. and from the mentee. It has to be clear from the beginning, and they have to also agree in between, like in the pair, how they are going to best work together. Again, the mentor, and I'm repeating a bit, but the mentor, we encourage that they are involved as much as possible in all components of the program, and like throughout, from day one to day whatever, 200 maybe, I don't know. And the mentors can also helping building this networking and this community of practice. And to conclude, I hope I've not reached the 5 minutes. To conclude, I would say the benefit of the mentor and the mentees is both for like the programs, the GLLP, but also for them individually to build their own, let's say, networking and their own professional growth, even as a mentor, and building this really multi-sectoral networking or community of practice as a result of, let's say, being together for the duration of the program. So the mentorship component, hopefully, or I hope, will not stop after the end of the program. This is something the program cannot control, but this is also something that can be even longer and serve the mentor and the mentee even after the official end of the program. For now, I will stop, Lidovai, and let me know
Thank you very much.
I still have time or not.
No, actually, we actually have to be a little bit quicker in our. It's so interesting, so I think everyone's getting carried away because it's lovely to talk about all these components of this project of this program, and that actually takes us to another super interesting part of the program, which is the project-based learning. So I'd like to hand over to Jennifer and ask her. These projects, and Virginie briefly mentioned capstone projects, this is where the participants start putting their learning into action and actually applying it. Could you talk about how these projects support learning and also the lab system building that's been mentioned several times? Over to you. And if I go like this, it means that you have to keep it short. I've been trying that with the others, but they haven't really listened.
Try. Hello, everyone. Jennifer Lastly from WOA. It's a pleasure to be with you today. Thank you so much for sharing your time with us to learn more about the Global Laboratory Leadership Program. So as it relates to project-based learning, there are two different types of projects that exist throughout the curricula. One of them is focused on small projects, and those small projects reinforce didactic learning in the management and leadership sections of the program. And they are also developed to address participant laboratory needs and may ultimately be expanded to the larger system. So, for example, someone who is coming and participating in the program from one laboratory, we encourage participants to always consider their real life situation, projects that are going to support additional development or improvement of any particular aspect as it relates to the curriculum. As it relates to capstone projects, those bigger overarching projects, they follow from the laboratory system section of the program. And the capstone projects are, of course, bigger, and they're developed to address the real-world gaps that are identified in the current laboratory system. Throughout the GLLP, we help the participants to understand what are those gaps in the laboratory system, and so that capstone project really is supposed to address that real-world problem that's faced. The projects can be implemented at a lower level, of course. It really depends on the scope of the program, but they should be designed in such a way so that they could be, at the very least, scaled up to address system-wide needs as well. The projects also may be multi-sectoral, and indeed we encourage that they would be multi-sectoral in nature, that would engage the network to build and to grow across the different sectors of the public health system. The capstone projects are also designed to bridge this gap between the theoretical learning and the real world application, right? So really bringing to apply all that we've learned throughout the program to our real life challenges. And this is where true transformation and growth is expected to occur with the participants and among the cohort. It's specifically powerful as it relates to the laboratory systems and implementing the leadership tools that participants will have acquired over the course of the program. The projects also support the development of skills of their participants. So indeed, the application of that knowledge is a very key component of the projects and helps the participants to integrate practically the concepts that they learned. And that can be across any topic like laboratory management, but also quality management, quality systems, fire safety, biosecurity, leadership to address their real problems, and also problem solving. So helping the participants to identify, analyze, and address specific issues which foster their critical thinking. In addition, system strengthening is a major component of the skills that we're trying to focus and build, with targeted interventions that address specific areas of need, and also addressing the sustainability component by helping the build competencies, supporting the critical thinking, and then allowing participants to address the persistent challenges, gaps, issues, so that the projects can contribute to long-term improvements that can be self-supported, that don't require an enormous capital investment over time. We also support leadership development in terms of change management and helping the participants to lead their projects, gain experience in managing teams, resources, and stakeholders that, of course, are the key skills for future laboratory leaders. And then, as was mentioned by my colleague Virginie, building in the mentorship component. This also supports skill building in relation to collaboration and networking, where we have also a lot of cross-border learning that require or involve collaboration with international peers and that expose participants to different and diverse perspectives and best practices from their peers and colleagues in the program. Also encouraging partnership and network building, so engaging with local and even, why not, global partners that help to build those personal networks and institutional networks to align the projects with broader health goals. There's also a big focus on evidence-based impact, so focusing on really building in data-driven approaches, making sure that the projects are evidence-based, that require data collection, analysis, and evaluation as a fundamental component of those capstone projects, and focusing and encouraging on scalability. So helping to encourage successful projects that can be scaled up and amplify their impact. We have a couple of examples of the capstone projects. For example, in the human health sector, a GLLP participant revised and updated the standards for laboratory diagnostics of cholera for the National Medical Laboratory System of Ukraine. So given the disruption of infrastructure and impaired access to potable water and food, the risk for cholera outbreaks is high or very high in many parts of the country. And so the Ukrainian regulatory documents associated with the laboratory were also found to be outdated. So after an extensive review of national and international regulations, the participant developed algorithms for cholera diagnostics and identification and standardized reporting forms. She mapped the laboratories that performed cholera diagnostics, developed a referral process for specimen confirmation and identification, and also developed a cholera outbreak action plan. So from these actions, she developed updated standards for cholera diagnostics that would be included in the technical guidelines for cholera surveillance. And these standards will be reviewed on a regular basis and are currently pending approval by the relevant hierarchy, which will be then incorporated into national guidelines. So I think you can see right away starting with simple ideas, really trying to identify specific needs, and then understanding how the laboratory network can work together in order to solve societal problems related to health. It's really a wonderful example. There's also an example in the environmental sector with the ongoing conflict in Ukraine. The same situation has led also to the disruption of the coal industry, with the mines being damaged or closed. And so rainwater and groundwaters that seep into the mines and the working mines has to be constantly pumped out. And so when the mine is damaged or not used, it fills with water containing heavy metals, radioactive elements, and oil products that could end up in surface waters and contaminate drinking water around it. So the project aimed to develop and implement a procedure for assessing and managing the disease risk from mine flooding during armed conflict. So as you can see, really some very compelling projects that we've been able to support through implementation of the GLLP. I hand back over to you now, Lida Bai.
Thank you. Wonderful. Yeah, I think this is a really a key component because it tests real life learning. Did the messages from the didactic component come through? Okay, with that, I'd like to hand back to Jocelyn, and Jocelyn will get her last question, and I'm going to ask her to be brief because we have actually gone over time for this session. So what is the GLLP community of practice, and why is it an integral part of the program? And what strategies work well to keep a community of practice active and engaging? Over to you, Jocelyn.
Thanks, Levi. I am going to try and be as brief as possible, but that is not to minimize the importance of the community of practice, because we really have found that the community of practice is really key in the development of cohorts over time. So what is a community of practice? A community of practice is really just a group of people who share a profession, they share an interest or a passion, and they want to learn from each other through ongoing interaction that is through a standardized platform for communication. In the GLLP, the community of practice can include all the people that might be involved in the program, the participants, the mentors, the instructors, program staff, other stakeholders, all could be part of the community of practice. And really what's important is the community of practice will grow with each cohort. And it will grow over time, creating a wider and wider network of lab leaders. The community of practice can be hosted on multiple different types of platforms. Really, the most common platform used is as simple as a WhatsApp group. There are more advanced electronic platforms that can allow for things like document storage or integrated communication, but really you don't need to have a fancy platform in order to have an active and engaged community of practice. Some of the benefits of a community of practice: it enables ongoing knowledge sharing and networking amongst its members. It can support professional development and problem solving. Members can ask for advice. They can share leadership resources. They can troubleshoot challenges. And because the GLLP cohort represents the different sectors, the human, animal, and environmental health, the community of practice really becomes and is a practical expression of the One Health approach. As far as ways to engage, a community of practice takes work, but there are some simple strategies that you can use. First and foremost is assigning a program staff person to monitor the community, and also to identify one or more community champions who will help spark conversation and encourage participation. Should set clear group norms from the beginning. Establishing a rhythm in communications is helpful. You can do things like weekly or monthly themes, a Monday tip or a mid-month question that can help engagement. You can do micro engagements, short polls or one-word prompts or photo sharing in order to engage your participants. And these small asks lower the barrier to participation, and it also helps to bring quieter members into the discussion. You can share bite-sized, high-value content. You can share infographics or screenshots, distribute new publications, conference announcements, or relative local news. It's also important to recognize contributions. Celebrating wins and highlighting members' successes can also help to maintain energy and enthusiasm. WhatsApp, using a platform such as WhatsApp, the WhatsApp messages can get cluttered, but you can use pinned messages, starred messages, and reply in threads to help keep things organized. You can also use tools like communities and broadcast lists and polls that can give you a more structured management of the community. And I would also say that asking members for feedback is helpful. Asking simple questions like what would make this group more useful to you can help you create a community that's responsive and aligned to the community's needs. And I just will close in saying that the community of practice is really much more than a messaging group. It really creates an environment where your participants in the program can continue to grow even after the program is complete. They can support new leaders as they're coming up. It does take work, but I think with thoughtful facilitation, it really can become a powerful tool for network building and system strengthening. So I hope I've been short enough, Lidovai. Back to you.
Absolutely. Thank you so much. So summarizing that, the GLLP is not just a didactic component. It also has mentorship, it has project-based learning, and it has a community of practice component that makes it more interactive and hopefully more sustainable learning for the long run. So if I can just ask you for the next slide, I think we're going to have to wrap up because we've gone over time. If there are burning questions, I think we can probably say to put those in the QA, and I will sit and answer, and the speakers will also in the Q&A box of Zoom, because unfortunately I think we've gone too far over time to now have an interactive Q&A. So I think I will hand over to Jennifer. And but feel free, please do reach out. Just because we're skipping the Q&A does not mean that we're not here to answer your questions. So please do reach out even after the webinar if you have any questions or any ideas. So with that, I'd like to hand over to Jennifer for our GLLP video. Thank you very much for the panelists.
And now, in their own words, a GLLP video.
To help ensure that laboratories can effectively play a critical role in the prevention, detection, and control of diseases, current and emerging laboratory leaders worldwide need specialized training in leadership and management. While other leadership programs exist, there was a noticeable gap for training with a One Health approach. A One Health approach considers multiple sectors of health when designing and implementing programming and policies to create a well-coordinated approach in human, animal, and environmental health. Leading organizations partnered to develop the Global Laboratory Leadership Program, or GLLP, to focus on human, environmental, and animal health laboratories, as well as laboratories with public health impact. The 6 partners enlisted the expertise of over 140 global experts in human, environmental, and animal health and laboratory science for the development of the GLLP. The partners are committed to the program's vision of laboratory leaders empowering national laboratory systems across the globe using a One Health approach to strengthen health security. Through our funders and public-private partnerships, the GLLP has succeeded in providing training to develop leadership skills in the laboratory setting.
So excited to hear about the LLP program because of the existing frontline epidemiology training program that had been in place. I felt that it was a great program, but it didn't have a space for us laboratory professionals to meaningfully contribute.
Leadership, mentorship, and the in-person course materials, including PowerPoint presentations, and working with the instructor were the most helpful parts of the curriculum.
the biggest takeaway is looking at the lab in a system, not in isolation, not just looking at an individual laboratory and our systems, but looking at how we can use what we have and share with other laboratories so that we can grow as a laboratory sector, regardless of whether it's human, animal, environment, or agriculture.
One Health has been hugely addressed under the umbrella of GLLP. We have collaborative MOUs now with the National Agriculture Council and the Pakistan Agriculture Research Council, along with the environmental sites, whereby they work together in launching of different projects and conducting combined research. This will go a long way, helping us not only the lab side, but other subject areas as well, and in turn translated into meaningful actions.
I have already recommended to professionals from diverse fields to participate in this program, as I believe such a unique opportunity should not be missed.
So thank you. Next, we will be shifting to a more in-depth overview of a country experience implementing GLLP, and in this case, it's with the country of Oman. So I'd like to introduce everyone to Dr. Shadia Al-Balani. She's an associate professor at the Department of Biomedical Science, College of Medicine and Health Sciences at the Sultan Qaboos University of Oman, and she has led this department for the past 7 years. She obtained her PhD in cellular and molecular medicine from the University of Ottawa, Canada, and she is currently heading the Quality Assurance and Academic Accreditation Unit in the college. She has a vast experience in institutional and medical program accreditation, as well as curriculum design and review. She's an external reviewer for the Institutional Standard Assessment with the Oman Authority for Academic Accreditation and Quality Assurance of Education. Her research interests are in cellular and molecular pathology, mainly in cancer, and she is highly skilled in cell culture and molecular biology techniques and has several publications. And with that, I'd like to invite Dr. Shadia to share her experience with GLLP implementation in Oman. Welcome, Dr. Shadia.
Thank you so much, Lucy. It's really my pleasure to be with you all. And hi, I will take you through our experience in GLLP in Oman. Although it was a wonderful experience despite the challenges that we faced, but eventually we went through it, and now we are thinking about the next stage. So the next slides, please. So actually, before officially launched in the 31st of January in 2022, there were a lot of arrangement and preparation behind the scene. And the request actually came at the peak of COVID. And in my opinion, I felt that it was a motivation for people to go into this program. And it was also like a strong rationale for the government to support. So initially, the collaboration was with the Ministry of Health in Oman and the US CDC under the umbrella of One Health. And IQLS was the big supporter where they provide and recruit instructors throughout the program. Next slide, please. So this is a simple timeline just showing you some of those tasks where we started and we finished. And it was clearly mentioned that the program might take 18 to 24 months. But in our case, it took up to August 2024 from the initial start. But the program itself, it was conducted throughout about 2 years and a half, because we had some, let's say, holidays And we have our holy fasting month where it was a bit hard to get some of those modules. Next slide, please. So initially, after the agreement and approval from the government and Ministry of Health, the National Working Group was consisted of 12 local representatives from different sectors, human, animal. Here we call it food safety because we have a big center in Oman regarding the food safety, but we consider it as environmental health. And as academic institute, I was one of the representatives from a governmental university and one of our colleagues from a private university. At that time, we stated and prepared the terms of references. Everything was established, and the kickoff, as I mentioned, started in January 2022. Next slide, please. So before conducting any project, especially a huge and very important project as the GLLP, we have to do some homework. So we had to do some of the lab assessment tools for both human and animal health laboratories using those components, and by interviewing the leaders in those sectors and knowing about those different modules and their capacity and what type of modules that we can actually adapt to close the gap or fill the gap in our two main sectors of animal and human health. Although we get a bit of high percentage, but eventually, if you can please go to the next slide, we decided to select all the modules. So first of all, we send out calling for the CV. We had to prepare a certain CV template, pointing out the most important element that we want to choose in any participant or mentors. And this went through a proper channel, as you all know that it should be documented and officially requested. And we received a total of 63 applications for participating in the program and for both mentorship and participation. And then we have to filter all those applications based on certain criteria for selection, and those criteria was discussed in the National Working Group. Next slide, please. So these are the criteria. I hope they are clear. We had honestly like a big argument. It's really hard to decide who's senior, who's junior. So with a consensus with everyone and in consultation with other, let's say, related parties in certain laboratories, we came up with these criteria. We had to have for the mentorship, as previously mentioned in the webinar, they should be more experienced and they have the ability and skills of leading the teams and also mentoring the juniors in their own field. So this is in general. For sake of time, I will not go through all of them. Next slide, please. So as some of you know, Oman, we have different districts. We tried to sample, although it was geographically difficult, but we managed to get everyone together, especially in the face-to-face sessions. So we had two samples from all the country, as you can see. And eventually we collected 20 mentors and 28 participants. And as I showed you previously, the criteria selection. And we tried also to have representatives from different governors in the country. Although Muscat will show the highest level because most of the big labs and reference labs and centers are located there. Next slide, please. So this is just to show you the percentage of selection. And as you can see, the human health always have the bigger portion due to not despiting the others are not important, but it's a common thing in most of the country, the health sector always exceeding in number and distribution. So we had 60% of the whole team from the human health, 29% from the animal health, and about 11% from the food safety for both mentors and participants. Next slide, please. So this is one of the pictures for those face-to-face sessions. Because of the excitement and we were so eager to have the GLLP in our country, we decided to go with the 9 competencies. Although it was mentioned that the country have the freedom to select, but we decided to go big and select all the 9 competencies with the 43 modules. And honestly, we are not regretting it, although it was a lot of materials for the mentor and participant, but it was really very useful. And then we decide how to prioritize those modules based on the needs. So we didn't follow them exactly as it's written in the manual, but it was a random selection. And as I mentioned previously, we have some holidays, some restriction in our schedule. So we couldn't do it as in a short period of time. Next slide, please. I will not go through those leadership because it's already mentioned in the webinar. Next slide, please. This is a kind of showing how the stepwise progression in the GLLP learning. Start with introducing the module and having different sections in each unit. And this is just an example. For example, the active learning with activities and project. In our case, and I will explain it later as well, we had 2 divisions. For the mentors, it was online sessions, but for the participants, it was face-to-face. And this really was so excited for certain participants. Even I remember one case where a mentor, we select her as a mentor, but eventually she decided to be a participant because she really liked those sessions. And she felt that she will learn more being a participant in the program rather than a mentor. Next slide, please. So this is some of the pictures. The IQLS team used to visit us 1 week. The first 4 days, it was a face-to-face session where they have a lot of interaction. They have, let's call it a pre-test to test the knowledge of the participant. And then the same exam at the end of the session was provided to the participant, and we could see a major difference in the grades where they initially might get less than 70%. And once they finish the sessions, their knowledge increase and they get up to 90% and sometimes 100%. The instructors were very interactive, very knowledgeable, and they used to have like a lot of brainstorming, quizzes, and give chance to the participant to interact with each other. Even the distribution within the tables, they were mixing from human, from animal, from the food safety, and it's really caused a strong bonding between those participants, not only in knowledge-wise, but even in sharing the experience and knowledge from their own background. Next slide, please. So the delivery of modules for mentors, as I mentioned, it was online, and it was 1 day per week for each module, which sometimes take 2 to 3 months per module or competencies. And mentors were allowed to attend the last day of the face-to-face session to have an overall view about the performance of their mentees and participants, and also the working group members. The instructor give us a feedback on how this session went and what recommendation they recommend and what changes or challenges that the participant could face. So these sessions were really, really useful. They used to bring everyone at the same table, participant, mentors, and the working group. As also mentioned about community of practice, we had a Google Classroom created, and all of the materials for both mentors and participants were uploaded in there and easily accessed anytime. Sometimes we cannot attend those online sessions, but we can go back to these materials and read it and learn from it. And also we have a WhatsApp group, although it's not officially the best mode of communication, but it was an easy and quick way to communicate for both the working group, mentors, and participants. Next slide, please. This is some of the pictures, just to share it with you. Next slide, please. And for any program, definitely monitoring and evaluation is a very important element. And initially we started with interviewing the organization, instructors, mentors, participants, about what they're expecting from the program and what is their next plan and how this program might help them in progressing their career or exceeding or reaching their goals. Also, sometimes we have a personal goal forms. We send it in terms of Google form as a survey for those instructors, mentors, and participants, and to hear from them. The pre and post test that I mentioned before each and after session was really very useful. And those tests will help us later on when we implement our program as based on our needs in the country. The course evaluation, as mentioned by colleagues in this webinar, it's an outstanding modules, a lot of materials, but we had to evaluate some of these courses and the real evaluation will come once the program is adapted and provided at the national level. We also have a monitoring evaluation form, and in this form, even about the hotels, the quality of food, it was a very comprehensive evaluation, and based on their needs, we had sometimes to change the location of those sessions just to make sure that the participants are happy and they are really relaxing and enjoying their time learning more about those modules. Next slide, please. So it's a bit crowded slide, but I can just show you if you can focus on the green last column, this is showing the differences between the pre and the post test for the participants. And you can see that sometimes there is a 44% increase in their knowledge and in their thinking before and after getting or involving in the session. So this is at an average, we got around 37%, which is a huge percentage for the increase in knowledge within 5 days. Next slide, please. And this is also to show their progressing among those different competencies. And the average test that we had previously, before all these sessions, around 59%. And if you can see the post-test, it's that switching the numbers, it's 95%, which is for us, it's a great achievement. Next slide, please. And for all 9 sessions, the satisfaction was really, really high. And as I mentioned to you, we were even asking them about the food quality, the location, and everything. So they were really happy, both the participants and the instructors. Next slide, please. So when it came to the capstone project, everyone was so excited, so interested. They were so ambitious. We have to reduce a bit of their excitement because some of them came with ideas that you need at least 5 years to accomplish or establish. So the good thing that we request for proposals, and it was just a title and a short description, and it was submitted to the working group and the CDC. We had to go through all of those proposals and request the participant to present it to us. And we had a long discussion about the objectives, the outcomes, and we have to tune and polish some of those projects because some of them seems to be unrealistic and it will be difficult to finish in 6 months at the time frame given. And then we gave them about 6 months. And at this time, the mentorship level was really at its highest. And we were, as I will show you later, we were so keen to have a mix in the capstone project, where we have a participant from the animal working with the human, working with the food. So if you can see in each capstone project, there is a mix of all under one umbrella, which is the One Health. At the end, they present their results, and even to motivate them, we had to give awards and select the top 3 capstone projects. Also, we wanted to award the mentors for their involvement, and also we select the best 3 mentors just to motivate them and give them like a push to go ahead with their project. Next slide, please. So these are the projects. If you can, we don't need to go through all of them, but you can see from the sector. For example, the first project, we have all the 4 sectors, from the environment, agriculture, animal, and human. Sometimes because of the nature of the project, it was hard to have all of them, but it was when we revised the proposal, we could see that it can be also implemented in human or animal labs, for example, in sample transfer or in setting standard or SOPs and so on. Next slide, please. So we had 9 projects, and for each of these projects, we have at least 1 to 3 even mentors, because some of those projects was, let's say, huge in work, and some of them were the participant, one from the north and the other person from the south. So you could imagine the time and the effort and getting all those people together. It was really a big challenge, but we are glad that we went through it smoothly. Next slide, please. So lesson to learn. Yeah, can you go through them, please? Sorry, I wasn't sure that there is animation. Okay, can you go back, please? Sorry. Thank you. One of the things that we learned that we need really early engagement of the high-level officials. As I mentioned earlier, we were lucky that COVID was like a strong rationale and justification for us. But for people who or countries that would like to be involved, it's better to involve the officials. And here I mean the big umbrella, like the universities, ministries of health, of agriculture, all they should come together and have an early engagement. The laboratory system assessment was really very helpful to us, although eventually we select the 9 modules or competencies, but it will really help to find the deficiency and the gaps in your own system. And the One Health collaborative working group was really amazing. For me personally, I learned a lot of things just by attending those meetings. And even I was surprised, I didn't know in my own country that we are doing certain tests, and we are taking care of certain systems, and sometimes we are considered as a reference labs to the regional countries. It's really important to have a standard work plan and the terms of reference from the beginning and the country terms of reference. It will really help in structuring and knowing the needs of the GLLP in all laboratories. Next, please. So how to sustain a program? And as Dr. Osman colleagues mentioned, we really want to sustain it. We are in the process of conducting a post-implementation survey, a review for the first phase, and see what withdraw, what gaps, what good things that we should continue doing it, and how we can address these small hassles or challenges. And also we have to have a lot of consultation meeting with the academia, because eventually as a program, it should be hosted and adapted by an academic. And for that reason, I was a member representing the academic sector in the country. And now we are in the process of having recognition, accreditation by the company, by the country, And we already identify one of the health colleges in Oman, which is under Ministry of Health, that agree to adopt this program. And because we have our own national qualification framework, we have to adjust it to provide it with, let's say, postgraduate diploma or a master course. And we have to tune a bit of those modules and add more modules to give it to the, let's say, required credit hours for a full program to be established. Also, the working group headed by Dr. Amina is working on the TOT, and we had some meetings with the CDC, APHL previously to start establishing such, let's say, process and program. Next slide, please. So I just would like to acknowledge and close my presentation by showing that we had a lovely ceremony for our graduation, the first batch, and everyone was there, everyone was happy. And I would like to thank all those who contributed directly or indirectly to our program, and without them, it won't be a successful program. Thank you so much. Thank you for your attention and for your attendance.
And thank you for an excellent presentation, Dr. Shadia. That was really insightful. Just a reminder to the audience to please put your questions in the chat. And with that, I will pass over to Dr. Raftri.
Thank you very much, Lucy. Dear colleagues, partners, and all of our participants, it's been a real pleasure to be with you here today for this webinar. I'd like to really sincerely appreciate all of our speakers for their insightful contributions, and especially to Dr. Shadia for sharing the experience from Oman. Thanks also to, of course, our 6 wonderful implementing partners, as well as the Global Health Security Agenda Consortium, who are hosting this event and who invited us here to share our collective experiences today. And of course, thanks to all of you, our participants, for taking the time to join us from all over the world. So I think today's discussion really reaffirms that the Global Laboratory Leadership Programme is a truly unique One Health initiative. It's focused on building the capacities of current and future lab leaders through country-led implementation aligned with the international health regulations and the global health security agenda. And this makes GLLP a really important mechanism for strengthening national lab systems. So across all of the presentations and the panel discussions, the core values of GLLP, ownership, One Health, and sustainability were all clearly reflected. And these values are not only foundational, but also critical to ensure the long-term impact and resilience of the lab systems that are really the backbone of health preparedness, health emergency preparedness and response. So we also heard how diverse implementation models are emerging across different regions and countries. And I think this demonstrates the program's flexibility and adaptability to national context. This is a really important strength of GLLP because it ensures that countries can shape the program according to their own priorities, capacities, and strategic directions. Of course, the continued commitment of the GLLP's, the 6 partners, is really central to the program's growth. So our shared dedication to building the global laboratory leadership workforce is really vital for addressing the increasingly complex challenges that we face in global health. And together we are advancing the program that not only develops individual leaders, but also contributes to stronger, more resilient national lab systems worldwide. Looking ahead, we'll continue to refine and update the learning package, the guidance frameworks, and the implementation tools, and this will ensure the quality and consistency of the program delivery as we support countries to implement. So thank you once again to all of our partners, all of our wonderful speakers, and all of you, the participants. We really look forward to continuing this collaboration, to advancing GLLP together, and hope to see you all in the next webinar. So back over to you, Lucy. Thank you.
Thank you. And with that, we'll conclude our session today. Thanks for joining, everyone.